Persistent fatigue, unexplained weight gain despite the dietary efforts, hunger, craving even after eating, high blood pressure, dark skin patches. If you are experiencing these symptoms, you might be having insulin resistance, a condition where cells in your body don't respond to insulin's action. As a result, more insulin is secreted, which leads to fat deposition in the liver cells. In this episode, we will look into the risk factors of insulin resistance and how insulin resistance leads to fatty liver and eventually cirrhosis. My name is Dr. Bashir. Welcome to Health Harbor Highlights. When insulin resistance develops, the liver may continue to take up glucose despite having enough glycogen stores. And this excess glucose is converted into fatty acids through lipogenesis. Insulin promotes the synthesis of fatty acids in the liver by activating certain enzymes. When insulin levels are high, there is overproduction of fatty acids, which are stored as triglyceride in the liver cells. Insulin inhibits the release of fatty acids from the adipose tissue. When the insulin levels are chronically elevated, there is less release of fatty acid from the adipose tissue into the bloodstream. Chronic level of insulin exposure leads to mitochondrial dysfunction in liver cells. Impaired mitochondrial function reduces liver's ability to oxidize fatty acids for energy, leading to their accumulation as fat droplets within the liver cells. Overall, these mechanisms lead to non-alcoholic fatty liver disease, a condition characterized by accumulation of fats in the liver, which is unrelated to excessive alcohol consumption or viruses or certain medication. In some individuals, fatty liver may lead to cirrhosis, a late-stage liver disease. Here is how the fatty liver leads to cirrhosis. The non-alcoholic fatty liver disease begins with accumulation of fat in the liver, known as steatosis. This condition may cause liver enlargement, also known as hepatomegaly, and mild inflammation. But it typically doesn't lead to serious liver damage on its own. Inflammation and damage or injury to the liver cells often progress to fibrosis, meaning scar formation in the liver. Fibrosis is a process in which scar tissue gradually replaces healthy liver tissue. As it progresses, it can disrupt liver's structures and function. Cirrhosis occurs when extensive fibrosis develops, resulting in widespread scarring of liver. In cirrhosis, liver becomes nodular and may shrink in size. Liver function declines significantly, leading to life-threatening complications like liver failure or cancer. There are several factors which can increase the risk of developing insulin resistance. Excessive body fat, especially abdominal or visceral fat, is strongly associated with insulin resistance. Adipose tissue releases inflammatory molecules which interferes with insulin signaling. Lack of exercise. In some individuals, genetics, age, sleep disorders, unhealthy diet Consuming a diet high in refined carbs, sugars, and saturated fats, processed food, sugary drinks, and high-calorie meals. Prolonged stress triggers the release of stress hormones like cortisol, which can interfere with the insulin signaling. Addressing these factors through lifestyle modification is a key to reversing insulin resistance.